The Centers for Disease Control and Prevention quietly modified its coronavirus testing guidelines this week to exclude people who do not have symptoms of COVID-19, even if they've been recently exposed to the virus. Now, the move puzzled a lot of doctors and has obviously raised some questions. Joining us now to talk about the changes is Dr. Richard Chaffoo. Hi, Dr. Chaffoo.
Hi, Maria. How are you?
You know what? I'm great, and I'm happy that you're here. What did this newest revision state? What did they actually say?
Right, Maria. So essentially, the changes came about Monday, and it's basically, people that are in close contact with infected people, like people within, roughly 6 feet for 15 minutes or longer, do not necessarily need to be tested if they're asymptomatic. The exceptions in this were, people that were vulnerable or, healthcare professionals that might recommend testing.
I'm not sure how I feel about that, just considering how much we don't know. How do doctors and health professionals feel about it?
Well, I think all of us pretty much feel that there is a lot of concerns about the changes in the guidelines, because we need to understand that it's important to identify infections before people have symptoms. And this is actually a phase, Maria, where people are highly contagious. About half the transmissions of COVID-19 occur in what's called pre-symptomatic stage, and these are before we actually have symptoms. And so we'll be missing many people who are potential spreaders, and may actually make this worse. And we may actually see a surge with the virus, especially as now we're going to be going into the fall and into the flu season as well.
How about Dr. Fauci's statement? He wasn't even there for that meeting. Does that concern you as a medical professional?
Yeah, Maria, it's very troubling. I mean, as he clearly said, he was not really part of any discussion regarding this new testing changes. And, the concept is that people will get the idea that asymptomatic spread is not concerning, when in fact it is concerning.
I mean, it could spread to other populations that obviously are at higher risk. So that's obviously the big concern, right?
Yes. Yes, exactly.
Well, talk to me a little bit about, I guess, the reasons behind this. I mean, Dr. Fauci wasn't there to make any decisions, but regardless of that, are there any reasons behind the shift or the change?
I don't think we really know. I have a lot of respect for Dr. Fauci. He's certainly one of the great thinkers in this field. He has a remarkable medical history. He's a scientist. I have the utmost respect for him. And I think that we need to be guided by science and not by politics. And I'm speaking obviously as a physician, because our goal is to protect the public, protect the patient. And I think all physicians from all fields agree that these new changes in the guidelines certainly can potentially put many more people at risk, as you said, the vulnerable, the elderly, people that are immunocompromised, children. But, even healthy people can get this virus, as we know, and can end up in an intensive care unit on a ventilator and die. We don't even know the long-term outcome from COVID-19. There's some cases where people have had long-term suffered from chronic lung problems, much as like people that are COPDers, they have fibrosis and scarring. So there's still much to learn about this virus. We're still very early on in this process. We have to remember, this has been going on for less than a year, and much research is needed. But I think we don't want to take a step back and find ourselves, with another surge, which Dr. Fauci and other healthcare professionals have been very concerned about, the fact that we can overwhelm our healthcare system. We can overwhelm our emergency departments, we can overwhelm our intensive care units, and we can run out of ventilators, which obviously would be catastrophic.
And very quickly, in light of those changes that are being made, any advice to everybody out there?
I think what we talk about, Maria, all the time on Fox is, remember the simple things, and that is wear a mask. I wear a mask for you, and you wear a mask for me, and we're just part of being a good citizen. Remember the social distancing, 6 feet. Remember avoiding large crowds. Washing our hands, obviously, especially washing off contact surfaces, and just be aware, that we're putting other people at risk if we're not following these very simple guidelines. And it's unfortunate, Maria, if more people were to do what you and I and most responsible citizens to do, we could eliminate this virus. But I'm sure you and I constantly see, large gatherings of people where they're not wearing masks and other things. And the virus is highly contagious, and it's very, very easy to spread this virus. And remember, the public needs to understand, as of today, we do not have a vaccine. We're not really certain that we have a medical treatment. There are great minds and researchers are looking for treatments, but we're still very early on in this process, and there's much still to learn about the virus. So we need to just be vigilant and be good citizens, watch out for ourselves and the community around us.
Important reminders. All right. Dr. Richard Chaffoo, we always appreciate your insight. Thank you so much.
Good to see you, Maria. Thank you.
As more